Okay, on a kusha on a cabo. My name is John Fuller. I'm on a host for the Well Body Beteh Pass Gentri program. When a salon people don't learn boku book pass myself. Me and learn better. You don't learn boku book around the world. And when a salon people them, and then they bring this program to now. Yes, we can get people entertained. They will not to Sierra Leoneans. We can look and say they want benefit with community, then self can help you present. But we waiting at the panel, we waiting at the core program at the team. We as salon people that we based right across the world. We then practice within various fields. Everybody specializes in different things. We get nurses, we get mental health nurses, we get community health nurses, we get general practitioners, we get emergency medicine consultants, and Dr. Bell, for example, today going to explain himself, but in and around woman issues them now in study. So you go explain what they do and what's idea and stuff like that when they're ready for present. But we get a diverse team that they got help with. We bring this program to now not because we get paid. We not know they get paid, we only bring and come to now for the benefit we own community. Okay. Also now see today we do the 84th session, which means we don't be online now for over 5 years. Earlier this year, we celebrate to 5 years. Yeah, hello, Dr. Celestia, how are you, sir? Thank you for joining me. Earlier this year, we celebrate with 5 years anniversary. Today, we do understanding POS and PCOS, in Polycystic Ovary Syndrome. Me own book not reach that side for explain but I go left hand to Dr. Bell, we go explain them to we, what it be, what they cause them, how for manage them and stuff. Like most of one at the panel, me self they learn. I don't learn tremendously, I don't learn a lot. So we encourage people for pass this message, let other people then learn as well. So we go listen to Dr. Bell today and we go ask questions. Me say we go question them for ask, just like I said at the land. Today is Sunday, the 20th of June. And like I said, Dr. Bell now the present and I be don't tell I ready written my own name. And when I get the whole Well Body Beteh Pass Gentri panel, the team within the panel for us for answer any questions then we wanna go get. Okay. And I mean don't see already we are a group of Sierra Leoneans, then we based right across the world. We come together no more. We look and say we people in the suffer, certain thing in the person the dying as I know the suffer, it needless. You know, if only they get the knowledge. Me, not a medical doctor, I'm a business IT consultant. I work within cybersecurity. Now I'm Sabi. Anything for do with IT, I go try as much as I can for answer. Anything within cybersecurity, yes. Medical stuff, no. Okay. But one day we are the professional, then we'll talk to one. All right. Like I mean, say the program will record, it will be on YouTube and Facebook. But also, if you want to reach out to me, there's a WhatsApp number there. We also get a WhatsApp group. I will share the link where you can join. For data privacy reasons, we share the link. You can join anytime where you feel like, and you can leave anytime where you feel like. The group not to all man they able post it. Not only the admins them, and the doctors them. They will only post information we pertaining to medical stuff. So none of what we see, they will can begin post all kinds of things. No marketing or stuff like that. Now only thing that we will help with people them now no more they get posted on a medical term. All right. Now we want to ask question. I'll just run through this quick. Most of now they see this that's on our screen they look like. So if you click this three button now, you know, this screen will appear. You can use this for chat, just like how you use on WhatsApp. You can send me a message on Facebook. You can able to type your message and send them. Or you can use this for raise your hand. You know, for USABIT, you can use that. You raise your hand up. They show a raise sign. When I see that sign, they come up. I will come to you for ask. But if you don't want to do all of this, but you ask a question and you brave like me for sure, you find face. I didn't see me face fine, but you want to show you find face. Feel free for turn your camera on, raise your hand up. When I see you, I'll come to you. Do you have a fan? If I not see you quick, I not come to you quick. You know, means I ignore you. It just means I not see you quick, but I will make sure see everybody and questions get answered. All right. If that's something we need for take offline, like I said before, we'll take them offline. Now I don't talk beaucoup. Like I hand over now to Dr. Bello. We'll take on through the program today. If I get any, if I need any additional information, questions, suggestions, feedback, we'll not feel so perfect. Okay, there's always room for improvement. So if there's anything they want to feel say yes, we can make improvement on, send them to me by email or contact you by WhatsApp. But apart from that, I'll go quiet now. When I will only see me back towards the end of the program where it will be time for question and answer. But for now, at the hand over to Dr. Bell, we will take on through the program today. Over to you, Dr. Bell.
Okay. Good evening from across the world. I'll just first share my slide. Okay. So yeah, so good evening from across the world. Mina Dr. Christian Bell, Salon de Nomi Fertility. Mina Obsen Gainsadu, and my sole specialty in reproductive medicine and gynecological endocrinology. That means a day to decide now usai when couples and they try to forget speaking and then they forget picking, I mean, and they cancel. Actually, they treat male and female. We can to born picking business. And people always feel saying the woman the normal they go for examine and the woman the normal you get for treat. But in reproductive medicine, we know say if couples encounter we don't try for over 1 year, they don't forget picking. 30% the problem are the man in the pan, 25% are the woman in the pan, 40% are both in the pan, and 5% in for nothing. So theoretically speaking, we know say sometimes or most times that we put in the country, the man them can be the cause more than the woman them. So reproductive medicine, like a couple's treatment, not a woman treatment no more. For me, another day. But we don't do a few topics them concerning woman business. We don't do things like fibroid. We don't do endometriosis, for instance. I'd also do a topic on the basic reproductive medicine. Today, now PCOS we get for talk about, and I'll promise when I say we will definitely get for go back to the male side as well for show waiting. We will get one whole session we go deal with Andy as well. But today, as I say, polycystic ovary syndrome. Now something where you know they able for define. Make me pointer. Yes, you can't really define them. Germany also will call her poly confusion syndrome because it confuse people. You know, they only confuse some doctors them as well and other fields them. It confuse the patients them. It confuse the husbands them. Yeah, patients they come to me and tell me say, "Oh, doctors, I get boku system." And I say, "No, you don't get boku system. Not to so this thing also they." But you have to sit down and explain to patients then for make them understand the way that this thing is. So, but it's very, very, very difficult to define. And if you go one branch, like I make this kind of ticket, so as you go one branch, you get different area where you can go. Me, they try for cut through. Yeah, so that means say I know they cover one particular area, try for they make a broad base for make una understand what in this year so they're about. Because this name not they actually tell you what the sickness be, there's a campaign for change this name. This university in Australia get a campaign now when they take survey from health professionals and women. If you go on this website here, so you actually can go and click on it, and then you can also take a survey, and if you know somebody we know a lot about PCOS, you said he help for most likely change the name because the name really deceiving. But what we know is that this disease is so that the most common endocrine disease in women, yeah, and it's also a clinical syndrome. It gets heterogeneous symptoms, and the diagnosis now a diagnosis of exclusion. And also right now, don't confuse beaucoup people left. So we go this thing also one after the other. Yeah, waiting an endocrine disease. The endocrine disease is a disease, a condition when it caused by problem of the body's endocrine system. The endocrine system are the system where actually they produce and regulate hormones them. What's not hormones? Hormones are like the messenger in our body. One hormone where beaucoup people know na insulin, for instance. Yeah, then patient they will get diabetes, then inject insulin. Then like one of the messenger them, for instance. Yeah. So this disease here, so it gets for do with beaucoup of their messenger then they. So and we're going to talk about them as well. A clinical syndrome, like collective of signs and symptoms, them where they occur together, And it also they present a specific disease. But one thing we really sad is that they actually understand the underlying cause, and that's now one of the things them where we know say PCOS gets. Yeah, so they actually know why make some woman they get some, why make some woman they don't get some. And why make it severe to some woman them, and so other woman they know for enough severe. Why make some woman for live with them, some woman they know for live with them better. So it's very very difficult and it's also they make it also they cause a lot of problems to a lot of women then. And when I say heterogeneous symptoms, that means you get different individuals there where they get a wide range of symptoms there. Wide range of symptoms, and the severity of the symptoms that can also very different. That means the way they treat the patient, you actually get for treat the patient individually. Yeah, each person you get for analyze them, see waiting they actually they affect them, and then treat them accordingly. And this diagnosis of exclusion mean, say, you get for check and make sure, say, get no other disease. You get for exclude all other diseases them before you finally say, okay, well, this woman also has PCOS gets. So when I understand now how complex this issue, and for explaining in one session, it's not easy, but I will try my best. So now let's make wait talk about the diagnosis of exclusion. Now all the thing there so you get for make sure say the woman not get. Yeah, I know go confuse and go through one after the other, but just for show now no more. Wait you get for look for. We don't make sure say that woman don't get none of the thing there. So now you get for say, okay, well, definitely that PCOS you get. So now you make with the call this thing here so polyconfusion syndrome, because it's not easy for doctors, easy for patients, easy for spouses, easy for family members. Yeah. So we get for understand them patients then they, and also be empathic to them patients then they. We know say that about 5 to 18% of women them within the reproductive age, that means that age they also in the born picking, we get this PCOS. And 50% they go undiagnosed. I mean, they actually know they want to get and they don't even know they get them. 50%. Yeah, as we don't say, it's multifactorial and it's also partly genetics. Now that's we they don't find out recently. It's also partly genetics, it's partly environmental, but it's also partly genetics. The history for PCOS, okay, we don't start from the 17th, 18th century where some people then describe them. And then in the 1920s, we get two doctors that will come together and write a whole paper about it. But they say 2003, with two societies then Europe and America, reproductive medicine societies in Europe and America decided to something, let us meet up and let us discuss this thing here. So and let we try get a definition. But even still, they don't even forget a real definition about it. 2003. But then decides, okay, if we get 3 criteria, then if the patient gets 2 of them 3 criteria, then we will say this patient get PCOS. And the 3 criteria then are 1, they see in period regularly. Yeah, we'll come back to that later. Secondly, either you actually see the woman and say, oh, it look like a get beer, or it gets some male features them, or when you take blood from them, you actually find out say the male sex hormones they are high. Yeah, then I call it hyperandrogenism. Or if you do an ultrasound, the ultrasound scan, you watch the ovaries then, you actually see small. Everything the patient can say, oh, the doctor can get system. Small follicles, then follicles we will call them. Small follicles them, where then they in the shape of them woman that we get them pal chain them. And so it's in shape. And so you look. Get small follicles, then they round so. Then we see this here so, and the woman gets 1 or 2 of the other one, then you will say, okay, this woman here so gets PCOS. Normally, now we get one follicle where they grow bigger, and this one follicle line the boss, and they release the egg, then call it ovulation. And then after that, now this follicle, they change now, it turns to what we call corpus luteum, and this corpus luteum itself, they produce hormone them, where they actually there for support the pregnancy. We call them progesterone, so pro-pregnancy hormone. But usually, if woman gets this kind of thing here, so they get what we call the arrest. So that means one follicle, they grow big and ovulate. So I make the woman know they get the ovulation. But we will come to that later. We watch ultrasound. We do ultrasound scan. Now so you look. It's typical, as you see a woman, you know so straight away, oh yes, this woman gets PCOS. And then when you do laparoscopy, where you watch inside the belly now, so then through there, so this one also and this also that the ovary. See the small, it's like a cocoa, small, and follicles them where they boku on both sides. Yeah. And for information, the one that we don't know, this also with the front here, so then the ovary, now the womb this, and then the fallopian tube, yeah, now the one this where they go down so. The other one, this way they go down so. Yeah, this also where the sina so and also this are guts. Now the guts part this. But as now seen so it look inside the woman in belly, where they do that laparoscopy, where they watch with camera inside the belly. But the main thing for me gonna know that so the ovaries then tan, where then get small follicle. They call them PCOM. So polycystic ovarian syndrome morphology now how something shape. So now so you can say either get PCOM, you get the high male sex hormone, or you cycle irregular. So 2012, the National Institute of Health in America decided to say, well, if we get a treating there, so they'll just create what we call a phenotype. Yeah, so you get a phenotype A, B, C, and D. That means the one at A, and the one will get all three. Then the B, C, and D get only two different one them. Then that means if patient come, we examine them, and then we go for classify and say, oh, is that phenotype A, phenotype B, phenotype. Just for me to understand, yeah, I don't need for know that because they're all medical, but for me to understand how the development of classification, the development of the different things that happen. And if I now say, look, it's not that long, yeah, from 2012, then they decide to say this also will be the right way for go. And then 2018, actually 4 organizations come together. Yeah, the America one, the Australia one, America, they come together and decide, say, you know, something, let's just make an international evidence-based guideline for this thing also. For me, if doctor gets this paper, yeah, so he able to read this paper, yeah, so he go able to understand this thing, yeah, so and he go able to treat patient then. And also, patient, if you go online, you Google this, yeah, so even patient then when a patient then he able to access this document and able to read them. A big, boku, complicated, but sometimes, especially women, the way they suffer from a night for make them just get an understanding about this thing, yeah, so. And then 2023, 2 years ago now, then they upgrade this guideline. And you see under us now more organization on decide, yes, not true, this is an important thing, get to it, and so they for create an updated guideline. This thing as well, we don't say is multifactorial. That means you actually not know usai start, you know, usai the patient because when I have that because of this year, so if the patient gets them, it's partly genetic. So it can be during the pregnancy, it can be the way if the picking inside the womb, it can be the time way the organs them where they would produce them messenger them the time when they build up and I think the thing happen. It can be seen at the adolescence and the teenager term. It can be seen at the adulthood. You actually don't know when the patient can develop them, and different factors then we can contribute to the development of this Western call. So for this sickness. So we can always, in Germany, we can always say we don't know which thing comes first, the egg or the chicken. You know, outside the thing actually starts. You know, and that debate, there a lot of people that can make that debate. So when I can think about that, because one comes first, the egg or the chicken. But it's very, very difficult for we concerning PCOS know exactly outside it start. And you get bubble symptoms them as well. Yeah, just like a few, and for name a few, you get the excess body hair growth. That means the woman can get bubble here, and get like a beer also. The name for control their weight, then also can get cysts. Then they develop the cysts them, now the ovaries them. Then get low sex drive, then cycle irregular, as we don't say. Then get this male pattern baldness and get them baldness like women they would don't age small when they get with the loss we hear now so that women they say they get lost their hair then get high sex hormone male sex hormone testosterone for instance insulin resistance that's a very important thing for make we talk about today fatigue pimples then that you face then you always mood and mood change can day and I mean they can also develop depression and then this also as in this area trouble for conceive and infertility. And also it affects both different organs then, yeah, and then it creates also associated comorbidities or other sicknesses then, like adipositas, yeah, then obese, for instance, they can get what we call this metabolic syndrome. That means high blood pressure, diabetes, then kind of thing, and they get what we call this non-alcoholic fatty liver disease. That means they store fat in the liver. They get the cardiovascular diseases, as I don't say, depression and anxiety. They can get the snore buckle, and they can also they can stop for brief within the sleep, and then it can be very dangerous. Infertility, as we say, and also endometrial carcinoma. Endometrial carcinoma is a kind of a little bit we discuss some people and say no, actually they cause that, or that people get a higher risk forget that, but yeah, some studies don't show say yes, women them we get PCOS get a higher risk for getting endometrial carcinoma. Endometrium, now the lining within inside the uterus, inside the embryo, the fertilized egg they attach. Where the woman can be pregnant, so that lining there it can turn cancer. Women that we get PCOS get a higher risk forget that, and as we say also diabetes. So within we they do now the reproductive medicine we say we divide this thing into three categories. Then we get the reproductive, you get the metabolic, and then you get the psychological aspect of this disease. And the reproductive side, we get the irregular cycle, we get a high male sex hormone, you get the infertility, and also you get pregnancy complications then we can also have. We'll go through this also one after the other. But first, for man they within the forum we might not know, and also women they will go look for know more about this. This is the menstrual cycle. This is the reason why make a woman and they bleed every month. You get this hormone FSH, follicle stimulating hormone, where actually they stimulate the ovary, then the small follicles, and the small follicles, then where as a pan the PCOS, and then can they. So one with that hormone they camp and the messenger camp and the ovary, one follicle they be activated, and then it go bigger, say it gets like then 2 centimeters so, and then you get this LH luteinizing hormone where they increase, then they show the body say, okay, well now you for ovulate, that egg day you for release them. Yeah, the egg they mature and then they release them. So this follicle here, so in they produce estradiol. This estradiol, now it actually they help for make the endometrium, the lining of the uterus increase. So after the ovulation, you get this corpus luteum, this yellow body where they form. And this yellow body now they produce this progesterone. The progesterone, now they actually transform the endometrium for make the endometrium accept the egg, the progesterone, pregnancy, pro-pregnancy. And then the woman pregnant. But if the egg not fertilized or one way or the other, the egg not reach the ovary, disintegrate, then this yellow body, this corpus luteum, they disintegrate. And because this yellow body disintegrates, the progesterone level, they decrease. And because this progesterone level decrease, the one they bleed. So man, normally the cycle about 28 days. So I'm saying like once every month the woman they see in period, and it's actually the period now actually you try to get an egg, see if the egg will fertilize, and if it not happen, you man bleed. So that means every month for the young girl picking away no go. Know that every month the probability for make a woman get belly day, especially if the woman they see in period. So waiting they happen by the PCOS is that then small follicles are then so boku, then they produce another hormone when they call AMH, and antimular hormone, and the antimular hormone they arrest the follicle them. So the follicles one another aim for increase, like a traffic jam they happen, and then one not aim for increase. So because one not aim for increase, the estrogen level not they increase, so means this endometrium not they grow, this cycle not they happen, and because this cycle not they happen, you know they ovulate, so you know this in period. So the reason that make woman then we get PCOS can get they're not in the same period, or they get irregular period, because even if they arrest if the traffic jam day, the thing still go they move small. The traffic jam they can get a salon. They move small still. And then it will ovulate after like a day 50 days, after then 30 days. So that makes a woman can get irregular period. So woman them no need period at all. So that for me would just understand what we talk about irregular period. Yeah. And with the same the irregular menstruation, now if the woman not they bleed for 35 days for the last 3 months, and call it oligomenorrhea. I'm saying you know they bleed often. Normally, then you see 28 days, but if you take 24 days, it's still okay. If you take up to 35 days, it's still okay. So they not say, oh, my period now 30 days, my period will not get problem. No. If you go up to 35 days, it's still okay. Now, if you go above 35 days, at least 3 months, then we not say, okay, you get this oligomenorrhea. And then we get the amenorrhea. The amenorrhea, now, where you know the see period at all, or you only see period like a 2 times for a year. And you get the what you call the primary, you want the one that will not ever bleed at all. Yeah, woman can start for bleed like the 12, 13, but if you find out they don't reach 15, 16 or bleed, then they can call them primary and amenorrhea. They get different reason because of for this, not only PCOS, but other different reasons. I make, as I say, diagnosis of exclusion, you know, and then you get the secondary, that means the woman we don't bleed before, but then after 3, 4, 5 years, it stop for bleed, and the secondary amenorrhea. And the high male hormone, you get different hormones that we watch, and different calculations that we can do. And one bought just for show within the blood values that we can take, and very important, you have to take out at the start of the cycle. Yeah. Yes, by the PCOS patient, they want to say, okay, well, you know, bleed 30 days. Who's in the cycle? And they still like start of time, you know. So by then, they can very difficult for no who's stem. So some doctor can say, okay, you get for induce the bleeding, we don't induce the bleeding, and then you take them. But we will do, and so we take her anyway. Even if now the 30 days you know bleed, we can just take her anyway, and then we see if we will induce the bleeding, and we will induce the bleeding, we take her back. And then one thing I got to know is that if we take pills, when I take the contraceptive pills, it can also alter them blood values in a day. So we can advise patients and say, therefore stop the contraceptive, and then 3 months after we take the blood values. But other different blood values that we will take as an important owner, we name them. Important is AMH, as I've been on top of the way they cause the arrest. We get different other blood values then we for take. And you also for take them blood values then because, as I've been tell you now, diagnosis of exclusion. You get for make sure see all the other thing there, so and then most of them are also endocrine diseases. Them means the messenger can disturb. So you get for check and make sure say patient don't get none of these before, because I don't get patients before they can say, oh, I don't bleed for the last 6 months, and then I take blood, find out the woman pregnant. You know, so you actually get for check and make sure so the patient don't get none of these before you say PCOS the patient gets. So with the clinical hyperandrogenism, As I say, you get the pimples and called acne, you get the hair, excessive hair growth, and then you get the loss of hair, and also you get this so boku woman can get this dark colored area, now the neck area, sometimes now the intim bereich, to the intim region, to the vulva. But we therefore understand, say, different ethnic groups them they can get this kind of thing here, so, and also they can get a lot of hair. So as I say, you get for the Washington thing, the blame people individually as well, and check if they get the other thing, the irregular cycle or any other thing, we go suggest to you say na PCOS you get, not just take the one thing and say, oh, na PCOS you get. And the infertility, as I said, that in the male area, we know say it disrupt the ovulation. I've explained to now how the cycle they that's why they get the arrest, so that I make the ovulate, so that I make if you not ovulate, the egg will not be released, the human can't be pregnant. But the one main thing that a lot of people then can ignore, now say PCOS women then can get pregnant. They really can get pregnant, and then they can get complications inside the pregnant during the pregnancy. Like a miscarriage. A lot of PCOS patients then they get miscarriage. I know to one or to two, they can always get miscarriage. That means that not means they're not go born, but and they get a lot of miscarriage. Then you get diabetes during the pregnancy. They get what we call pre-eclampsia or eclampsia. That means protein high blood pressure, and this is also a very risky thing where sometimes they get for do cesarean section immediately. So that make also the preterm delivery can also high, the rate of cesarean sections can also high, and sometimes you get small for dates or large for dates babies them. That means the baby they're either big for them time or then small for them time. Now all the complications again they can back for PCOS patients. So now it make it always nice for diagnose them patients and also control them regularly during the pregnancy. And by the metabolic side, you get what we call the insulin resistance. You get the pre-eclampsia, you get the pre-diabetes, you get the diabetes mellitus type 2, and then the cardiovascular disease, they also increase the rate of the cardiovascular disease. Within insulin, as I've learned now, insulin are one of the messengers there where they regulate and they store glucose either the liver, the muscles, or fat cells. So if they convert into fat, they store inside the liver, now they get a fatty liver, we don't talk about. Or you store the fat cells, that's the woman and they gain weight. So you actually see that the reason that we Boku patients, if they get insulin resistance, they gain weight as well if they're not careful. And we find out say 95% of women there we adipose, obese, and get PCOS, get insulin resistance. But the one thing a lot of people ignore is that 75% of the slim women them back we get PCOS, then self get insulin resistance. And then they are the danger because that one then did that then they gain weight later on in life. Yeah, and they still go get the diabetes, then still go get the cardiovascular disease, even if they're slim. And at the end of the day, they actually overlook because the one day we're obese, you see them, you explain to them, then say, but the one day we're slim, they get the chance for do that because they think say that they go happen. Somebody been do this, Carlos Moran been do an experiment. He give woman and glucose, and then he say, okay, well, last week that happened. What happened to the insulin? Who give them glucose? I'm saying the woman in the camp, it's nothing, an empty stomach, then give them glucose. Then find out say by the woman there with BMI, body mass index, the one that will get high body mass index, the insulin they spike up, and they stay up for a long time before being go down. Yeah, the one that will get PCOS and then slim, then say they go up. But the normal one, they will not get PCOS, and they go up that way. But the one thing we will not get for know is that when we eat, we insulin they increase. So let we say this woman now, we assume say yaso he eats. then it spike up. If this woman don't gain weight, if he eat around the area there, so that means about 2.5 hours after if you don't eat before, it's still there up here. Waiting for happen. It spike go back. So that means that kind of woman there, you don't overweight already. Then it gets a high insulin level. Then when it gets a high insulin level, what's that happen? It is store more. So you get this what we call this vicious cycle where the woman can say, I don't eat boku safe, but I gain weight. The one problem with them people in there is that they eat irregularly. And that's the main issue. People like always say, oh, what you eat, what you diet, but they talk only about they always talk about waiting people in the eat, then they talk about when people in the eat. Yeah, for our information, we want to measure this insulin resistance. We get we have to call the HOMA index. It's not the formula we will use, and then we take blood from the woman them, and then if the HOMA index they above 2, if they be above 2, they can suspect you get insulin resistance. If they're above 2.5, then they say you get insulin resistance, and if they go above 5, that means you get a higher risk now for diabetes. And when it comes to the cardiovascular side, we always know say there is a group of things that really happen where they cause the cardiovascular disease. Yeah, but the one main thing where they happen also fat and calcium and calc they be formed in the blood vessels them, and then blood vessels and then at the heart. 9 they cause the cardiovascular disease, 9 they cause a heart attack. For instance, if the same blood vessels in the brain back, 9 also they cause stroke. So you actually find that the PCOS patients they get also a higher risk for a heart attack and for get stroke. And we get what I'm saying this metabolic syndrome. Now, if you get 3, or then define as if you get 3 of the one of the 5 medical conditions there, so then you get the metabolic syndrome. And if you don't get that risk for get when you get the PCOS, you get the risk for get cardiovascular disease, and then you get the eating disorder, and then you smoke on top of that, and then the exercise. Then they actually increase your risk for get the cardiovascular disease, for get heart attack, for get stroke. And we don't find out, say, we Black sisters then get a higher risk for gain weight, they get a higher risk for get the insulin resistance, high blood pressure, and also for get cardiovascular disease. So that make it important for we sister them, for mama them, for pikin them, for make them know about this. And as I say, also the partner them as well, for make the awareness go increase in the country, so that people them go able for recognizing something like this day, and also treat them as early as possible, or regulate them and manage them as early as possible. But on the psychological side, yes, you get lots of women them we will get anxiety, especially when they get picking. Just imagine if they get 2, 3, 4 miscarriages, what that they will do to you, will go into depression, and especially if you not get support from you from a partner, get support from society. Then definitely you'll go into anxiety, definitely you'll go into depression. Some they can also get this negative body perception. Not all. We tell God, we gladly say now people them that kind of stigma they don't go, or they go slowly, but yes, and still get the negative body perception, and also then the libido, they not want forget for sleep with their partner, they not want forget sex, and then they also can unbog the rate of fertility. We know say up to 60% of women that will get PCOS get this sexual dysfunction, and that's really, really sad. And what to make you always do, I can always first start with general questions on feelings, on the interests, about the fears. Then I go to specific questions as well, talking about the sexuality, about the eating behavior, and also how they see themselves. So I make women they talk to them, especially if I get overweight patients. I know I always tell them say, I know they talk about you weight, not to you weight with a try for for fight or for reduce, so we aim that day, we aim now for regulate your insulin. And if we don't achieve that day, the result, we think it happen. Now you might lose weight, but not that they will fight, not that they will talk about. Yeah. And if I find out that the patient really need a psychologist, then I can send the patient then to a psychologist. I know saying at Salon now you get psychologists there as well, and I hope say gynecologists them where they diagnose patients with PCOS go also think about that, say therefore send the patient there as early as possible to a psychologist. So that means say you know careful realize say PCOS not to bang the doctor they deal with them. Yeah, you need nutritionists, you need psychologists, you need gynecologists, you need endocrinologists. Endocrinologists are the one that really deal with the hormone, the messenger area. And you need other doctors there. You need cardiologists as well if you're beginning to get a cardiovascular disease. So you see, it's actually an interdisciplinary approach you get for take, and you know the aim for cure them. Like the only thing the people we're gonna say, oh, I've been get PCOS. No, you get PCOS. Yeah, now you able to manage them properly. So now you make they get any symptoms anymore because you imagine if you stop for manage them, you'll find out say then symptoms they go come again. And you treat patients depending on the symptoms and also depending on the stage of life. And I will find out say when the people that are young, teenage areas, you get different symptoms then. Then they try to get pregnant, or when they get pregnant, you get all the different symptoms them, and then when they don't stop for seeing period, you get different symptoms them. But the one thing where they go across the board, or two where they go across the board. Now, the obesity and the depression and anxiety. So now you make them two things, and they be really careful, watch them throughout the patient in life. And as I say, different doctors, them when they're young, now the picking doctor, and then if they get problem with their skin, with the pimples, where they all can get, then you need a dermatologist, a skin doctor. Then you need a gynecologist, the woman doctor for if they want to get pregnant, or if you just want control the cycle. Then the endocrinologist, if you get for check for the hormone area, the sugar doctor for diabetes, the heart doctor, the cardiologist, and then when they don't get older now, you go to the old person doctor. So you see, you get different doctors. Then we can get different approach for treat PCOS, for manage PCOS. So that means we're young, now more on the reproductive side. We get older, now more on the metabolic side. You do, and throughout, you get for do the psychological side. Yeah, and the one thing that they throughout, but for reproductive medicine, it decrease according to your age, and for the metabolic, it increase according to your age. But the psychological side, it they throughout. And what are the treatment? The main important treatment now lifestyle. That is the main important treatment. Yeah. And then you get contraceptives, so we can give patient there the one that we in the season period. We get one medicine we call metformin. We can give patient, and we get insulin resistance or diabetes. As I say, psychological consultation. You get other medication, medical and non-medical treatments that we can do, like with patient, and we get the pimples them or the hair. If you from woman, and can one for remove the hair, laser the hair. And the one that we want to get pregnant, so they can get the ovulation. We can induce the ovulation through different medication, and you get this, we call this ovarian drilling, and then the kind of controversial, we not do it anymore, but like people can say, if you don't get all the options, you can do that. The ovarian drilling you go inside the belly and with the camera, and then I'm not sure that small different like pimples where they part the ovary, and they try for bust for chup the ovary different area then, so that then follicles then they reduce. As I say, now like a traffic jam, and the way pull some motor car then, the traffic jam the less. that's the idea. But people don't say they destroy the ovary if they do that. You don't know if you definitely reduce the woman in egg count. So now you make we only do them in very few instances. And then get the IVF. I will talk about it later. Lifestyle. Lifestyle, as I say, I can't emphasize this more. Lifestyle is very important. We don't talk about that. When I don't understand that now, why make it important for make you actually separate your meals, yeah. And the one main thing, you can get a balanced diet. Yeah, people can always say this Mediterranean diet. Yeah, now in our own country we get really good food, and the one thing we get, we a lot of countries, them, especially the Western world, they crave for now really natural and also low in fertilizer and really good food. Yeah, it's just sad to say that we always want for get that packet thing. Was we go to supermarket to go buy that packet thing, and that kind of thing for our outside for cook fresh, for its fresh for its vegetables, for its greens. And all and we get in a fruit we blessed with them thing in a fruit and a salon. And I hope say doctors are able to tell patients them waiting allowed for it and waiting not allowed for it. And as I say, for avoid irregular eating habits, we advise patients for eat 2 times a day. I know very difficult. Sometimes I can start and people say, the manable and the answer not necessarily start from today to tomorrow. You can look at small. But the aim is, as I said, dandy and the aim and dandy with the try for fat. You need to try the aim not for reduce weight, but the aim now for make sure so you're able for eat like between 9 and 11 o'clock and 9 a.m. and 11 a.m. and 4 p.m. and 6 p.m. After 6 p.m., we can advise patients not for eat. And the one main thing we for avoid now this snacking. That bubble after cham when they eat between. Yeah. People can say, okay, well, if you want cham in between, then it's nice for cham nuts. Yeah. And salon we get granates, that is not bad. But if you still try for avoid cham, the only thing way for eat in between or for do in between and for drink water. Soft drink. For avoid soft drink. And theoretically speaking, this one is also one for PCOS patients and for everybody actually. You know, soft drink consumption at salon is too high. We for reduce them, we for try for drink water, at least 2 to 3 liters of water a day. Exercise, okay, yeah, you get some kind programs there where they can tell for different age group and different, but me can just generate, okay, for make things simple, just try for get a moderate type of exercise 30 minutes a day. Yeah, at least then they go help. And waiting at the moderate, the brisk walking, yeah, for work fast for 30 minutes. That day at least is the basic, that start dandy. Yeah, we could always also encourage people then for do muscle strength, for build more muscles. Then they say very important. But for make things not complicated, just 30 minutes a day, a moderate exercise, and 2 to 3 times a week, muscle training. But if you want lose weight, then you get to do more. And what time you do? It help you. It help in your mental health. It help in your performance. It help in the metabolic, and also the productive side. So I'm saying, exercise alone they bring a lot for women them. So I make I always emphasize exercise. I emphasize also. I say there are four pillars. What you eat, when you eat, cardio. I mean, it's like brisk walking and everything, and muscle training. Then 4 things in the. If you just think of them 4 things in the, and then you set goals. Yeah, that's I can always tell patients for do set goals. Just say, okay, today I'll try for the next 3 months for waka 10 minutes. Yeah, because people be like, oh, I don't get time. I say, yes, you get time. You get for faint time. Start slow, start with 5 minutes and then increase to 10 minutes. By the time you don't reach half an hour. So please, exercise is very, very, very important. And it's just a basic formula. Yeah? You get your food intake, you get the energy expenditure. I mean, if you take more, if you food intake high, you gain weight. If you energy expenditure low, you lose weight. If the equilibrium, they at the same level, you maintain your weight. So the one thing we want for make you come off from this side, at least like kaya force. Yeah? Before you kaya. And people say, oh, that means I got for begin count my calories. Not actually, you don't need for. Just get for see which they happen. Some patients they can always think, say, I start today in 3 weeks. I've lost 20 kilos. No, come by that. It takes a while, and they go up so. You can go so, they can come back small, they go up, they come back small. So it's like you not get for be frustrated the way you see the effect. We think say forget. Then make a always tell and say forget what you wait, because even if you exercise and they build up muscle, you're not gonna lose weight the way how you want to lose weight, because you actually build up muscles as well. So not be frustrated if they lose weight, just continue. And persistence, that's the name of the game. As I say, set reasonable goals, reasonable and achievable goals. It's not a sprint. So 100 meter you run, like a marathon you run. You get for update your goals regularly. Yeah, avoid weight gain and try for lose 5 to 10% in 6 months. I mean, you don't need for lose 5 to 10% in 3 weeks. It takes time. And I always tell patients, say, doing it, they should say you take your PCOS seriously. Because if you say, oh, I don't get time, I get for work, then this important thing we get for day with you the rest of your life, you need to take it seriously. Metformin, me not so big fan for metformin, but they can say it can help. So some very difficult cases, they can also give patient metformin. But people like can feel say they go take metformin and then they not change their lifestyle. I could say no, it don't make sense. Any patient to me we don't want to change your lifestyle, I don't need for get metformin. But metformin you get for increase the doses slowly. The maximum dose is now 1,000 milligram in the morning, 1,000 milligram in the evening time. You get for take after you don't eat, and then so when you take a 1,000 in the morning, 1,000 in the evening time, you see you really also go with the time way they eat as well. Yeah. And you can also check the kidney and the liver function, because it can affect the kidney, it can affect the liver. So I make me, as I say, I make me a fan of and you can't think, and they say if possible not for drinking alcohol. And then for the so get some people and say, oh, then it's one whole day. They say no, if you take metformin, you get for it. These are the side effects that we can get. Get gastrointestinal symptoms. They may get people that can get diarrhea, they can get vomiting. Yeah, truly when you get you get vitamin B12 deficiency. But the hypoglycemic. That's a people the patient they can feel say they can hypoglycemic when they take them, but no hypoglycemic. But as I say, for me, like kind of a last resort, me not to person away things say because you get some doctors that they start with what things say wrong approach. So you get other things that you can do. You get this belly operation when they can do. They can try for small you belly, the bariatric surgery. And also you get other medicine that now when they take the famous one we all man know that is Ozempic. But honestly speaking, as I say, then last resort treatment down in the back, because the patient supposed for don't be disciplined already, for don't change the lifestyle already before they consider anything they also. And you therefore realize that losing weight not to the results where we want actually. Because if you do that thing there, so if you do the operation there, so you do this operation, you take Ozempic, you know they only lost fat, you know they only lose fat. They also lose muscles, and the muscles that we need. So if you're not disciplined enough for train and build up your muscles, and you take this here, so it can even be negative to you. So like, I always tell patients, say, please, 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 if I consider anything else, so try for don't change your lifestyle, try for be disciplined, try for get a routine in that area day before they even consider that. You also get high surgical risk when it comes to this operation here. So, and because people and they lose weight that much, even with also Ozempic, we can tell patients they're not for be pregnant in the next 1 year. Yeah, because it can cause picking it smaller and also can born early. So let me go tell patient and say, if when they take this medicine, please in the next, or take the medicine or I do your operation, when not for be pregnant in the next 1 year. So for the reproductive medicine side, this na the skill we can use, or the level of treatment that we can use. We can start first, as I say, most important. I'm sorry, this slide is not German. I try for find in English, and then for find in English, so I make the present in German, but I will explain to you what it mean. And this first line, okay, first line, I know it's a first line, now non-medical, non-medicine, you take non-medicine, now lifestyle modification. That are the basic one where everybody for do. And the first line medicine where they can get at this letrozole. Yeah. First thing, I mean clomiphene we may give us, but we studies don't show say letrozole better pass clomiphene. I make we don't switch over to letrozole, but sometimes letrozole definitely work, and the patient they can take the medicine like from the third, fourth, or fifth day of the cycle for 5 days. And same thing with clomiphene, with clomiphene back. Clomiphene, I think Salon can call it clomid. Also, from day 3, 4, or 5 for 5 days. Yeah. And sometimes you can increase the doses as well. And then if you don't work, and then people can say, okay, maybe for give metformin. Some people then can actually start with metformin, but I say, you know, so they for start, not don't have for start. You know, and if all the things don't work, then you get the gonadotropin where they give an injection, like the FSH. I'm not sure now on that slide, say that FSH, then they stimulate the ovary for make the ovary for make one follicle develop. So this gonadotropin also na FSH. Give them the FSH, they can increase the dose small thing it work. And if all that they don't work, now they can say, okay, look, do that ovarial drilling, that laparoscopic ovarial drilling, for see if you they actually reduce the traffic jam. And then we don't do that now, you give the FSH. Because then that affect the normal day for only a few months, 3-4 months. And then after that now, it coming back because more follicles than they come. So now so the traffic jam they develop back. So we do this, if you do this, they go for do the FSH and they go try for make the patient get pregnant as early as possible. And the last resort now the IVF treatment. The IVF treatment now we stimulate the woman and so now the ovary now get small. We go not on one follicle normally they develop, they get like then 5, 6, 7, depends on the woman egg reserve. We get between 6 and 15 follicle that we aim for, and then we take ultrasound and we go in and then we puncture each and every follicle. We remove the egg there inside the follicle, and then we fertilize the egg. We can do the IVF. That means we put the sperm and the egg together, and then one sperm will fertilize one egg. But then sometimes the male area, so like the is also important if you treat them patient there, so you also get to check the man in sperm count. Because if you don't treat the woman, but then you not check the man, then you just again the medicine and tell and say, okay, yes, you don't get a follicle, then you induce the ovulation, then I go home for get sexual intercourse. You not check the man in sperm count, that will be detrimental. You give human medicine without even checking the man. Yes, I know so you get some areas there where some man can say, oh, me, I know so I mean wife get the problem, I wife get PCOS, me also okay. I can always tell and say 30% man, 25% woman, 40% both, and 5% you need nothing. So we don't find out say yes, you might get PCOS, but we get for check yourself. Because if you want to do the IVF and your sperm count low, then egg they not fertilize. what will they do in that instance then? Now, we select one sperm and then we inject them directly inside the egg. That way we do when the sperm count low. So that make it very, very important. You get some man they can refuse and talk, say, no, me sperm okay. Like I say, yeah, we man, we know say we sperm okay. We're not gonna problem. We know that. So the reason why make people do the examination now for make we prove to the woman and say, yeah, we sperm okay. Then they can laugh and they can decide to do one. But it's important say we can't reproductive medicine now coupled with the treat, not to the woman they know they treat. Yeah, and then we don't get the fertilized eggs, we let it develop, and then we don't develop down, we put her inside the ovary, and then we hope say the woman gets pregnant. So na PCOS then they I know say na book information. I hope say I able for break and down in the different areas then for me to understand. Take home message say PCOS symptoms and diverse and when they treat and multidisciplinary treatment for the diagnosis to the treatment. You get to make sure say you treat her, you diagnose as early as possible, you treat them as early as possible, and you bring if you're a doctor, most likely, or if you're a patient, most likely you have to go see different doctors them because interdisciplinary treatment you get for do. Lifestyle. I'm not go stop for talk about that. Lifestyle changes helps considerably. Yeah. And then if you try to get pregnant and you get irregular cycle, we always advise you to go see a reproductive medicine specialist. And also psychological support is very important. Psychological support not mean only psychologists, it mean also support from partner, support from family members, and as alone we big on church and mosque, support from the areas as well. And I know say recently I get from know say there's a awareness group in Sierra Leone who I find very good. I mean, find them really impressive. And I hope say a lot of people then go able to go and join the awareness group. I tell you, thank you for your attention. If you want to get in contact with me, you can get in contact with me through Bodi Beteh Gentri, but you also get in contact with me through Yares Fertility Consultancy or Yares Fertility Consultancy, an online consultancy where they talk to couples about infertility and tell them within that the diagnosis where they go get for do, and then they can go do the diagnostic and then they come back with the results, and then we can talk about possible treatments them, or I can show them area them na salon or out of salon where they can go for treatment. And I can get to me through my website, or you can write me an email, or I also get an Instagram page where I can go where I get a lot of information also on PCOS and male factor and on the other issues as well. I tell you, thank you.
Thank you very much, Dr. Bell, and thank you everybody we join me today and we don't listen. I hope say we all don't benefit from what we do. Like I be say, and this is an area where something they hear. Some of we were lucky or fortunate enough we don't hear somebody on talk about it, but as to how it happened, within the cause and stuff like that, I believe say Dr. Bell don't break and down. One of the benefits of this show, not to say them over just for explain things, but now for break and down in we own language where it will be a lot easier for them we understand. Okay, I hope see people don't learn from this. Thank you very much, Dr. Bell. Now we don't open for questions. So if anybody get any question for ask, this is the opportunity. The only time no more with me take offense, Dr. Ben, I will say someone with the loss here, like how we someone cannot the carriage. So they try for say who the loss here.
We lost here. Yeah, unfortunately, because we said so level that will happen. Yeah. But I go and tell people that when man in the lost here, I go and say, well, you get what you get a high testosterone if you're gliding.
They actually use them as an excuse that will place and the stress now work let reduce my workload. Now you don't can bust me, you don't can bust the myth. One of the questions I will ask, while they wait for people to ask, one of the questions I ask, I know say some people then go look and say, I mean a man and stuff like that, but man them, like how Dr. Bell say, man them, we get a massive part for play in NTI. It better let we understand. For like one, we will provide, we partner them with the support with they need. If we partner, they suffer from many of the NTI. But two, is that if we understand NTI, some of the pressures that we can put, but we wait for them, you know, it's unnecessary. It better follow we understand. So one, we go give them the support they need, but two, show that understanding. So if they go through certain challenges, you know, let give them the support we they need. You know, instead of you walk away and say, this, you know, better not in our so I go for better society. Something they maybe a better you just try for support that person where you get and not try for being something good. Right. One of the questions I want to ask. All women we get PCOS get cysts as well.
No. And cyst, okay, let me define what a cyst. As I say, the name very confusing. We call them
Okay,
PCOS.
cyst in the ovaries, basically. Yeah.
Yes, polycystic ovary syndrome that people get bogboko cyst. No, but they get bogboko small follicles, and the follicles them now they actually return to cysts at the time. Cysts for me now like a bigger follicle. As I say, the follicle they develop up to a certain level, and then I want to see if I go to the picture back. I don't stop for share. Yeah.
No, it's still a share. It's still a share.
Okay. Yeah. Okay. So you the. I'll just go to the back. Yeah. So one follicle will be stimulated, and then that's now this FSH is follicle stimulated hormone. They make this one follicle go bigger. They go take it to 2 centimeters, and then ovulate. So you get three things that will happen. You can either be say this follicle will not go so, not ovulate. Just continue to go bigger, 3 centimeter, 4 centimeter, and 5 centimeter. They would call a cyst. Or it ovulate, and this all we form lock, and it continue for collect fluid, either even blood safe, because women and blood they can collect. Then instead it turn a cyst. You get what they call endometriosis cyst as well. They're different area than they, but basically then the two things happen, and the third thing can happen is that so women then they develop, especially when the egg is have low, and they develop the follicle. This tears will happen at the first part of the cycle. It happen at the second part of the cycle. And when it happen at the second part of the cycle, this information that they come for say you get for Bosso. So because that information then they come, they continue to go bigger and bigger and bigger and bigger, and then we call it cyst. So a cyst now a bigger follicle. That's what we assume. And women them we get PCOS get a higher risk for get down there as well, because the cycle could be irregular. You didn't know exactly when the traffic jam they stop, then one start for go. So then they back the cause their hormone they also not for regulate the way it's supposed to regulate. So they make them get a higher risk of get cyst.
One question I ask for women we get this PCOS when they get belly, how this thing they affect them? Did they affect them at all?
Yeah, then the back
and waiting them for look out for basically.
Yes, then the back I talk about that as well. So it affects them. Because pregnancy complications, they get miscarriage and they lost them picking. I get a few patients they were PCOS where they also lost them picking, and the 50% we don't know say they get PCOS. That then gets also a higher risk, because if you get PCOS, you also get PCOS, then sometimes they came for manager, but the one that we don't know, they will get a higher risk for get miscarriage. Why? As I say, you get that progesterone, that pro-pregnancy hormone. So if the follicle not the ripe properly, and that yellow body, that corpus luteum, not the form where it's supposed to form, the woman will ovulate, fertilization will occur, so the implantation will occur. But because that progesterone, that pro-pregnancy hormone or messenger, not the other way, in order to maintain the pregnancy, so that make the woman and lost in pregnancy. And then they also get diabetes and in pregnancy, pre-eclampsia, I guess pre-eclampsia, bocuna salon as well. And then mostly when they get anything, then you get for pulley picking alley, so they can get in preterm delivery as well. They get a higher risk for get cesarean section as well, because we want make them deliver as fast as possible. Now pulley get for pulley picking, get for do the cesarean section. Yeah, so that these are the complications the way they happen during pregnancy.
Okay. Anybody else get any question for ask? Yeah, let no shame. Because I wanting this as well now we community. This stuff for we all. More than me. I still get problems anyway when it comes to for go see doctor. Most of the time we can get issues that really bother we, but we not feel empowered to ask. Now this program we don't say I'm time and again, we don't ask, say do ya. If you find out say somebody gets something, a person able to confide in you, like your responsibility, one for keep that person there in secret, and two for give that person the support. Let not try for stigmatize people. If somebody want to ask question, like I said before, I will share the number again within the chat. Because sometimes some of we can feel shame maybe for come out, in a program like this and say you get them. But you can get away for ask question without, make them obvious saying you. But it better for let you ask that question, they not to just for benefit yourself, but somebody else go there maybe we want know about anything in there. So you go find like you ask the question, like one, then put and give the right answer, but two, somebody else get able benefit. Because once this program go online, that person will watch them online will get an opportunity for ask question. But if you don't ask the question, you don't benefit that person there indirectly. Okay. We don't do 20 pass. If I not get any more questions, then waiting go happen. We'll go around the panel. Maybe the other doctors then go get something for add on to this topic. Then we go round up for today. Okay, so I will start with Dr. Kamar. Dr. Kamar? Dr. Kamar? Okay. Dr.
Yeah, sorry.
Oh. Yes, sir.
I don't get sorry,
hold on 1 minute. I get Agassi. Yes, boss. I'm sorry, I don't see you. Sorry. Yes, go ahead, sir. No. You need to unmute yourself.
Oh, mute myself.
There you go.
All right. First of all, Dr. Bell, thank you very much for inviting me to this program. I've been on this program for a long time, but I never get the time. I never get the chance or the time for me. I always want for getting to them, but I don't know what happened. But with that time, it can take me just past. I remember I said, "Oh my God, I don't go to that Zoom meeting." So until one day, me and Dr. Bell traveled together to Sierra Leone. And I get for explain to them. So it give me the opportunity this time around to put me in a box. It's send a vision to me because I've been in the group, group message, everything they calm down. And first of all, I know Dr. Bell 25 years ago. The first time I came to Germany, I met him at Göttingen. And these are the people in this way that motivate me for I be the way I be today. They make a study in this country and get my own degree. Although me not in the medical side, but me not the documentary side, me not documenter. I don't go for the Frankfurt Film Museum, and I'm always there on Tavix. Right now, if you see, I've been inside train and I don't on transit, I always do Tavix, but I make sure I will listen to them. So Dr. Bell, thank you very much. I'm really proud of you. I'm always proud of you, brother. My question what they ask now is, I mean, I'm not shame as you say, Dr. Bell know me a direct person, and I better what they ask him to all the panel before I go talk to them secretly. I talk to them directly.
Thank you.
Okay, I don't live with my partner, and in 9 years we don't married like 2023 December. I think I maybe invite Dr. Bell this, but you know we make her up. Because one of my best man. My wife is very young, and I feel she not get any problem for get picking. She's 28, and I'm 43. So, but what been the dates? You know, you gotta be careful with who's picking. I mean, something may occur like 4 years to be married. Yeah, something may occur, we decide not for carry on. So like I take like a week or something. So we decide for like get rid of them. But now we don't marry. We'll say, okay, now we don't marry. Okay, it's still a study. Or say, okay, but still, let's try to get something. But now we dip and fight on this thing. And up to today, nothing not commodity. And if you see me face, I really stress about this. Because as a young girl, I want to learn, we don't get too picking them before. I want to let something happen. And we don't go first. Like how Dr. Bell say, we don't do a treatment for them. But unable to see anything it's although in the stress too much, but me the thing them on me so much. So what's advice when I go give me now? Because I be able to say let the man self go test. But me they feel say really man they feel say after I don't get to picking sometimes you know what I'm doing. I not go shame. I they come up playing, Dr. Bell. So I don't know what in because from the word of Dr. Bell say the man self for do something. But me they feel say, oh okay, well I don't get to picking all anything in there because me and Dr. Bell get picking at the same time, picking at the same age. So what's gonna be my advice to all?
Thank you so much. Dr. Bell, over to you, sir.
Yeah, that's it.
Well,
thanks for joining. Well, say this also me you can talk that day.
I know,
yes. We can talk that day privately. We'll give you advice privately. But
Go by the blue.
the one thing way very, very important is yes, although you don't get too picking, it always still nice for 30. I can always say yes, picking don't 13, don't 14. I can say yes, 14 years ago, ultimately okay, but we don't know if ultimately okay now. So especially if the woman get to go to any treatment, get to go begin, they go do operation for check whether it tubes them free before you do all anything and the first thing we're supposed to do before you woman go get an all pin and they check if you spam. I mean, not to add thing for do. So if you check that day, we don't tick that box they say, okay, well now you find for make the woman check now for see if in get any problem, then they go. It's very, very important for make you check. As I say, it's not difficult, and especially me, I can always feel bad or feel sad if man did not check themselves and the gynecologists don't do all kind of operation, all kind of thing on the woman. And then afterwards, now you don't pass 6 months to 1 year now, and then decide, okay, well, fine, look, we'll check the man, and then check the man and say, oh, I didn't have the problem. After the woman don't go, so a lot of things, especially when you go do that operation for check whether in tubes they're free, that laparoscopy, now operation landing. And so, yes, please, if even if you're not making human no self, go check out for yourself, go see. So at least let yourself get clarity.
Thank you so much, Dr. Bell. There's another question in the chat. What they say, which are the common symptoms then of PCOS in women and how it affects their daily life? I know say we don't touch on this already, but maybe the person joins slightly late. So if you can able to give a summary of that, please.
Yeah.
The common symptoms and how it affects their daily life.
As I've been done say, the symptoms they're diverse. They're really, really diverse. I can just show just get out of here and then show a slide for me because I always like for where at the talk they want also the CM as well. These are some of the main symptoms then we the woman then they get. And it gets the excess and not again, and please not just take one and say, oh, I get PCOS. Yeah, because that's so we can misdiagnose ourselves. Even doctors, when are doctors themselves, they misdiagnose. Yeah, they get some people can say there's also a kind of over-diagnosis. You get a lot of people that when they can say they get PCOS, when they come to me and say, no, sorry, you don't get PCOS. But as I say, the general symptoms now, excess hair growth, and weight, for controlling weight, you get the cysts, we don't talk about the low sex drive, irregular cycle, also, as I said, this insulin resistant and affecting if we go take blood from it and find that they're out, making moody, get high testosterone level, and that is symptoms that we can get, and then can lead now to different diseases them, like obesity, like fatty liver disease, cardiovascular disease, anxiety and depression, fertility, sleep apnea, and at the end of the day, also the endometrial carcinoma And as I don't say back, the different symptoms get for do with the different stages of life. You get for and I make it an interdisciplinary thing where you get for go to see different doctors them. But as you when you're young, more on the reproductive side, and when you're older, more on the metabolic side, and throughout you get also psychological effects. So I make an interdisciplinary approach we get for do for make sure say the patients then get the full treatment.
Okay. Thank you so much, Dr. Bell. Yeah, Dr. Charles, anything? Welcome, sir.
Hello, Doc.
Thank you very much. Thank you very much, Dr. Bell. I'm happy I owe you for accept the invitation, and I'm really happy for being here.
Yeah.
And thank very much our able leader, your big brother, Dr. Kabara, and to the entire Bodi Gentri. I'm really happy I'm able to make it today. And once again, I'm on my personal behalf, professional behalf, on behalf of the Ministry of Health, I want to thank you for our continued engagement from the diaspora. The program is always very informative, very inspiring. And then I continue for supporting her. I missed the award ceremony. I was in London 2 weeks ago. I went for camp. They mixed the ticket up. I come Switzerland. I went for camp. I go India again. I just come back. But I get for one go back free time because I get for got my holiday short. But trust me, when I get me support, I come physically for pick me award. That's why they come physically on a Sunday with the president, with chairman, Mr. Kumar. Trust me, so they can. Yeah.
We'll look forward to that.
Yeah, okay. Thank you. So once again, thank you very much.
Yeah.
And then I look forward to this. And Dr. Bell, it's been phenomenal, informative, inspiring. I'm sure a lot of people know. Some of you as doctors don't refresh with memory. We all often gain knowledge. We don't become a bit what they call in this area. But thank you very much for refreshing it. If I get any speech anywhere, trust me, I will deep into the knowledge where you don't refresh me today. I thank everybody and all of you, and have a pleasant evening. At this Switzerland, I have to go back to next tomorrow.
Okay. Okay.
Thank you.
Thank you very much, sir. Thank you. All right, so Mifambulem, I don't know if anybody else gets any more questions. Okay. All right. Dr. Kamal, we want to go to you first, but because we miss you turn, they can't to Dr. Turi. Dr. T,
fine by me.
You get any final word for people today?
Well, Dr. Bell, thank you so much. I know we repeat all it you don't say, but I think this is a well comprehensive. You know, you talk about the multidisciplinary approach into this way. I like most because finally people they know say not all woman one grain they suffer this thing here. You know, some people get the ideology say, oh, this now woman sick, so now woman no more for know about them. But the man them gets a great role for play, and society as a whole gets a role for play for understand waiting this, so then we will forgive, support, and not go give that blame and that unnecessary stigma, you know, to the woman. You know, we know when it comes to reproduction, we own culture, you get that pressure, especially we just married, picking no come, hey, the pressure they say, oh, wait happen when you not get picking. You know, if there people are not saying a multifactorial reason, not to just one reason. You know, you can't say you get picking. Even we say in a clinic woman and they can, the first very question then they ask is if then they get picking. You know, well, especially once they don't may go arrive to a diagnosis of PCOS, and we ask if they get picking. You know, and of course, you don't answer that question. They yes, they get picking. You know, just that the chances like the other person, you know, different. But if person follow all waiting, Dr. Bell don't talk so, definitely you go able for get through things, and you go able for, you know, get a happy life and a happy home. You know, if the woman happy, the whole home they happy. So
happy wife, happy
is a happy
life.
life.
Yeah.
Which when Yanda they talk say and I they stress past the woman. Bravo to you. Bravo to you. So thank you so much. Okay.
Thank you very much, Dr. Ture. Dr. Kama.
Well, how do you follow that? Anyway, I don't get much for say, I'll be honest with you. Because of the fact that, this thing, as I say, Dr. Bell don't do such a good job that, so technically you don't get much for it. But I just want to draw the attention of everybody to one thing. He mentioned, say, 5% no. You can't find any reason we make this not happen. So I just did draw the attention to people and say, I tell you what, so 10 and day, then we don't do all kind of tests. It's not like we brother Mr. Agassi there. Although you don't get picking them, but as Dr. Bell said, there's nothing to say. In 14 years, nothing will happen. So it's nice for you don't check yourself so that you can avoid any kind of problem. So that when they find out, say, the woman not get problem, then go do all kinds of things and then they end up with that. So that 5% there, people don't get for understand, say, then you go left for God in your own intervention. And they can say divine intervention, and that can happen. But of course, if finally we understand, say we don't exhaust everything, we don't do what we have to do before we actually end up with that thing. Now that makes them say a diagnosis of exclusion. And one way the tick boxes as they go along, it's important for you to remember that. Because for jump on the human no more, you don't get picking, that means the human this and that and blah blah blah. Well, it don't work like that at all. As I say, now family unit problem. This not just the woman or the man, now family unit problem. So important for them to know that. But the good for me to appreciate say we there for actually supporting her. Which we now want for let we talk about now we will talk about. Today we don't talk about the human them with the ovary when the tank now they when the egg then they come out. The next one now we go talk about something different. But again, we want to know for sending then topic then they so we go for look into them and give them the supply. Again, we need to get paid. We don't get no sponsors. So if anybody know one way we will get a sponsor, we will get for let we pass the word so that we will get airtime na free tongue na salon for let we people in Yeri which we get for say it go beneficial for everybody. Remember, if you help one person, now everybody else should help. And that's not the vital thing. So we all know say, well, but even the doctor need the young company doctor. Therefore, remember, if you enjoy exactly, if you enjoy this talk today and you know say it benefits you, please pass the word to the other person, make you come and join. Because waiting do well body, better pass Gentri. Thank you so much.
Thank you very, very much, Dr. Kama. Dr. Angela?
Good afternoon, everyone. Thank you very much. Are they hearing me?
Yeah.
Okay. Good afternoon, everyone. Thank you very much, Dr. Bell, for such educative and well broken down presentation. Myself don't learn a lot. Thanks to all the people that don't ask questions, all the people that don't contribute. Dr. Senesi, we're glad for see you. Thank you for attending. And if I'm them when I don't hear the word, Dr. Bell don't tell we what we for do and let we take them very seriously. The one they were not able for join and I tell them, let them know say this recording go there on YouTube, then you always go back and go review. And when I spread the word on ISF, waiting Dr. Kamara don't say, we look for people them for partner with, we look for sponsors them, we need help for spread the word, especially in a salon. And I thank you for joining and when make we take all of this into good part. If I know somebody we need help, make them reach out. And I not forget say, well body, it better pass Gentri. Thank you. Over.
Thank you very, very much, Dr. Angela and Silsamo. Thank you so much. Dr. Rashid, is still there with me? Auntie Gogi?
Yeah. Good evening, everybody.
Yeah, please give you a final word.
Yes, and thank you very much, Dr. Bell. Me, the one thing I get for say, that from the mental health point of view, obviously the anxiety and depression and sadness and all the emotional trauma the way that person the woman they go through. We get to think about the man as well, in as much as we know see sometimes the man then go certain way if they feel for seeing woman not get, the woman they get belly, you don't know the reason, especially in a salon, especially in Africa. But for like I understand, say psychological support they now for all groups and they now where they form, then they're very good for people them, because it's not just about the physical, but the psychological and emotional as well. And imagine waiting the happen upline where that woman did the struggle, for bomb picking, certain demand self the member for say like in West, I forgot to other woman, but since woman in the bomb picking, how that stress they all too. The man they get the stress, the woman they get the stress, the woman they get the shame, the embarrassment and everything. So now for like normal we support them everybody. Let we not call names to anybody. Let we not call the woman man cack and all them things then day because of what they happen to them. She can't help it. He not put on by himself, he not go by or anything. Now for support na person day. And just for that, we all members say no more well, but better pass gently and no we get so if we able to get support na free tongue or na salon, no we forget that support. So we go spread the word out as we don't do one for 5 years now. And for all no more again for say well body better pass gently. Thank you.
Thank you so much. Dr. Bell, you got anything more for add before I close for today?
No, I'm just
HRH though.
Okay. Not again. Cool thing. Yes, go on, Dr. Bell.
HRH there.
Dr. Bell, go ahead.
Yes, just tell Oman thank you will join. Please spread the word. It's a very, very important topic. And also for Monday with the forum, please support on a partner them because it's important. And also, as I say, the one main issue in a lifestyle. I will advise every PCOS patient for take that very seriously, and because then they not for only get for do with bomb picking business, they also get for do with your life in general, yeah, and your health, for making you get cardiovascular issues later on in life. So please, when this talk go on YouTube, I will also share onto the different form the WhatsApp. I will advise on also make on also share onto the different groups they want to have WhatsApp group, Facebook groups them for make people then get this information, because we all know well body better pass Gentri.
Thank you so much. Dr. Kamal, which one are anti-doc? I don't know which one I know.
Fatma K, I think.
Yeah, I don't try for asking for lay on mute. You know they're on mute.
All right, maybe busy. That's no problem.
Okay. Me fambulem, on have plenty thank you. On don't hear from the one they will learn book. But for me, we not just like una, we not get medical background. Una member, like I be say before, support, family support, people in need them. We people, we couple they married. If 6 months pass, 12 months pass, 5 years pass, you not get picking. Una not go begin put pressure on them. Una not know what they go through. If they explain to you, fine. They explain to you, give them the support. Not to follow you pass them out, you begin go and tell everybody else. If they not get picking it, pray for them, let God give them picking. You the man, if you have come out and tell you, try for getting that support. Una the human them, if una find out something, not keep them away from the man. Sometimes the way that man know is a lot easier than you try for keep them from my, they try for drink this medicine, drink that, they tell them, say as soon as they happen. He better let una know, so now to go manage the situation. But I don't hear from the doctors them. These are somebody who not get medical background. So me not just like una. But we will meet again when our members say, well body, he better pass Gentri. Good night.